Welcome back to the Doctor Connect show. I'm your host, Dr. Ludmila Schaefer, medical oncologist. The Doctor Connect is a home for open conversations, transformative education around cancer, health, wellness, and medical technology to bring the community, families, healthcare providers, and organizations together who share their expertise, opinions, experiences to help you to make informed decisions. Submit your questions to thedoctorconnect.org and subscribe our YouTube channel, The Doctor Connect. We are so excited because we are going live to have podcast in February, and we will be uploading episodes every other week. We want you to listen it certainly, and if you like what you're hearing, leave us a rating and review and tell us what you like about the show. Our guest today, Dr. Yan Leyfman, is one of the top international researchers in oncology. His success has been recognized by the New York Times, Harvard Medical School. He is an international scholar in immunology and immunotherapy. Our second guest is Dr. Dolores Fazzino. She is a surgical coach and has been in healthcare for over 40 years, and she assisted over 20,000 surgical procedures, and she is a best-selling author. Today, our episode is about very important topics: how to prepare for surgery, how to heal faster for surgery. Do you have your checklist when you are going for surgery? There are so many questions uncovered, and there are so many things to discuss. In addition, we also have a special guest to discuss about CAR T cell therapy and new research advances. What is it and what's new we can learn? If you're looking to success in 2022, stay tuned. I have my new book coming up that help you harness your power and implement realistic success plans to become a better leader, both personally and professionally. Our first guest, Dr. Yan Leyfman. He has been recognized as one of the top international researchers in oncology by the American Society of Hematology and American Society of Clinical Oncology, the largest oncology organizations. He has contributed to development of several anti-cancer therapies that have recently entered clinical trials, and he developed new treatment recommendations of care. His success has been recognized New York Times, Harvard Medical School, and his work recognized as an international scholar in immunology and immunotherapy. He is journal editor, mentor, and he has a passion for education, mentorship, and community service. And we welcome Dr. Leyfman. Welcome, Dr. Leyfman. Thank you very much for being with us.
Thank you so much, Dr. Schaefer. Thank you so much for having me.
Excellent. So with all expertise and experience, tell us a little bit about yourself.
Yes. So I am a U.S. trained MD with a background in immunology, immunotherapy, gene therapy, and COVID-19. I've contributed to several anti-cancer therapies currently in clinical trials and new treatment recommendations for care. Thank you.
There are a lot of interesting, new, innovative things and exciting news in oncology. And one of them is CAR T cell therapy. That is some of it concept pretty much known since 1980, but now it brought to a completely different era. Can you tell us what is this CAR T cell therapy?
Of course. So CAR T cells are living drugs. And these drugs, they have the potential to treat and possibly cure cancer. What a CAR is, so CAR is an acronym for chimeric antigen receptor, which is basically a synthetic receptor that is placed on a person's immune cell, in particular a T cell. After these T cells are collected from a patient, they are then genetically engineered in a laboratory with the CAR to target the cancer and then reinfused back into the patient's body, turning them into heat-seeking missiles that are primed and ready to fight cancer and largely sparing the normal cells.
Yeah, obviously, we all like about fighting the cancer. And another question arises, can we really cure with CAR T cell therapy? In the past, in old days, we all we want to cure. And right now, with new concepts in oncology, the word cure is kind of fading away because we believe that also there are dormant cells that might stay there for years and then wake up. So where are we standing with CAR T cell therapy in terms of cure?
So cure, as you had eloquently stated, in some ways is a very strong word to use, especially given the novelty of the therapy compared to other medications currently on the market. But a study did come out on February 2nd, 2020, detailing the 10-year success rate of this therapy to provide remission in 2 patients with chronic lymphocytic leukemia. And after this data was released, many oncologists are actually hailing this as a cure. And so this therapy does hold promise and immense potential, but it is currently not first line.
And what do you mean by not first line?
Right. So when a patient is diagnosed with a cancer, after the cancer is classified, there are guidelines of how to treat a person with that particular subtype of cancer. And we have first-line therapy, second-line therapy, third-line therapy, et cetera, et cetera, et cetera. So first-line therapy is therapy that have been shown to be the most effective in clinical trials for that patient. And those therapies are given initially. If those therapies don't work, then we go to second line. If second line doesn't work, then we go to third line, and so on and on and on and on.
And it's interesting that you mentioned, because since last time we met, I received some questions submitted from the audience, and someone asked, if CAR T cell therapy, such a promising treatment, then why we don't use as a first line? Don't we want to be the first, the best, and most new innovative?
Very good question. So actually, at one of the largest oncology meetings in December, a study actually came out, which was really one of the first ones to really provide strong evidence for putting CAR T cell therapy as first-line therapy. But it's still early and more data is needed. But we are hoping that within the next 5 to 10 years, CAR T cell therapy will be elevated to first-line therapy for most types of cancers.
So in this situation, when we use, CAR T cell therapy, and with all information, what if it fails? What is the next step?
Another very good question. So if a patient does not respond to this therapy, thankfully, we have alternative therapeutic options. And those therapeutic options can range anywhere from chemotherapy, radiation therapy, and or other immunotherapies, or a combination of them. But just like every person is unique, just like every cancer is unique as well. And so this is not a one-size-fits-all model, because one has to consider many factors like age, other medical conditions that the patient has, allergies, et cetera, when prescribing these therapies. And so the best advice that I have is that a patient should speak with their oncologist and really decide the best course of action for their unique condition.
And you're talking about conditions. So regarding conditions, what exactly other cancers, or where are we going to implement CAR T cell therapy? So
the most amazing aspect of CAR T cell therapy is its dynamic therapeutic implications. We began with oncology, but now it is slowly making its way into other medical conditions as well. Several weeks ago, the University of Pennsylvania was amongst the first to show the use of CAR T cell therapy in heart conditions. And as time moves on, CAR T cell therapy will be applied and utilized in other medical conditions as well. So really, we're just beginning. The field is still in its infancy, but it has so much potential.
That's absolutely true, especially the way medical knowledge moving forward. 50 years ago, 60 years ago, we learned something maybe every 10, maybe 7 years. And right now, we pretty much learn something every day and not pretty much every hour sometimes. So there's so many new innovative things. So can you tell us what is it exciting that you are working on right now? What's your latest research or project or something that we can learn?
So a majority of the research that I actually have been doing over the past year and a half is actually in COVID, but also the interplay between cancer and COVID. And last year, I presented at the American Society of Oncology meeting, which is one of the largest oncology meetings in the world, the first mechanism to really explain the connection between cancer and COVID. And so we are working right now to get that into publication shortly.
Excellent. We are all excited to hear. And thank you very much for all your work. And in addition, I believe right now, it's a lot of audience, everyone trying to learn, everyone trying to share their experiences. But it's truly the credentials. It's truly the work that you put every day, hour by hour. And let's say if the other, community, other healthcare providers, subspecialties, healthcare coaches, or someone wants to learn from you, how can they connect with you?
So thankfully, I'm a person that enjoys connecting with other people, and I'm not that difficult to find. You can find me on most social media platforms. I do try to post regularly on LinkedIn and Twitter. Those tend to be the most common platforms to find me. So feel free to connect with me and happy to speak.
Well, this is so excited. Thank you very much, Dr. Leyfman, for joining us today. And we definitely will connect with you soon.
Thank you for having me.
Now our guest, Dr. Dolores Fazzino, a nurse practitioner, surgical coach. She has been in healthcare for over 40 years and has been assisted on over 20,000 surgical procedures. She helps to heal faster from surgery and creates lasting health and true wellness. Dr. Dolores is an international best-selling author. Her latest book, Help, How Do I Get the Most Out of My Healthcare Experience, is a guide through the maze of healthcare. She is your advocate. Welcome, Dr. Dolores. Welcome, Dr. Dolores.
Well, thank you very much, Dr. Schaefer. I am so delighted to be here, and I am looking forward to sharing with your audience.
Thank you very much. And before we start, we discuss about different things we need to take care before we go for surgery, or maybe our family or someone in the community or beloved one. And I really would like to hear from you. What is your experience? Can you share with us your experience?
Oh, absolutely. Dr. Schaefer, I've been in healthcare for well over 40 years. I've been in the surgery arena for close to 35 years of that 40 years. And I've actually seen the ins and outs of people having surgery, and I've assisted on close to 20,000 surgeries in that time as an assistant surgeon. And so I find that the best thing that people could do is just to be really aware and mindful of the importance of having surgery. And I know that sometimes the thought of surgery just scares the bejeebers out of people, because let's face it, it's a fear of unknown. You're the most vulnerable you've ever been, because you're going to be under anesthesia, maybe, or maybe under local anesthesia. But the thing is, it's like you have pretty much given your power over to somebody else to take care and nurture you while you're in your most vulnerable state. Well, first of all, I always tell patients that I work with that just consider it another adventure. Okay. A lot of times, like I was saying, there's a lot of fear of the unknown, and yet people are going to tell you things that are important. And please make note of that and take that to heart, because I think sometimes people brush surgery off like it's no big deal. It really is a big deal because, you're, like I was saying, you're in your most vulnerable state and you want to make sure that you have the best outcomes that you possibly can. And there's certain protocols that, people talk about, especially when they prepare you for surgery in the hospital, certain things that you do and you don't do. It's very, it's to your advantage to listen to that and take that to heart, as I was saying, because that's going to add to your success of your surgery and also your outcomes when you're going through the healing process.
This is true. And can you tell us a little bit few tips, or maybe you have a checklist or something to share with us? What do we need prepare? Do we take our bag with us, or what do we do?
Well, Dr. Schaefer, it's like having a checklist is always a good idea. And I like to provide that with my clients that I work with. First of all, I think the most important thing is to understand your options. A lot of times you may have a lot of questions. Write those questions down, because a lot of times when you're in the doctor's office, all of a sudden the questions, go out of your mind and you can't think of them. But if you write them down, when you do go to your doctor's office or your healthcare provider's office before surgery, you could get those answered and addressed. I really focus on doing anything to alleviate the stress, like any type of stress management. You may want to use some massage, acupuncture, or even some Reiki or any type of energy healing before surgery, just to get you more relaxed in a calmer state. Like I was saying, ask questions. It's okay to ask questions. There's no question that is considered, inappropriate. Please ask your questions and get them answered. We want to make sure that you're feeling that you're heard, because that's very important. Maybe some questions are the timing. Do I need to have this surgery immediately, or could it wait? What are the complications? Maybe, am I going to have pain after surgery, and what are my options? When could I return to normal activity or, return to work? And, most importantly, am I going to need some type of support after surgery? Am I going to have to go into rehab or anything, or, have somebody come in to take care of me and prepare my meals? Those are important things to discuss before your surgery, so you could formulate a blueprint so you could have that. The next thing I always talk about is selecting your surgical team. Your surgeon, you want to make sure that you trust and like your surgeon and you feel comfortable with them. If you have the option of picking out your anesthesiologist, I also suggest that as well. Interview. I always say interview. It's like you're dating, and you need to make sure that there's a right fit, and the chemistry is there for people. I think most importantly is, like, people take this not as seriously as it should be. Just get the legal aspects, make sure you have your advance directive, make sure you have your consents for your surgery and your, if you're going to need a transfusion, anything like that, and also have a living will and a healthcare proxy. These are all important, and sometimes we forget about that in the gist of the moment, especially if you need to have surgery immediately. If you need to have something done quickly, it's already there for you. And, I think the other thing that's important too is, to follow your pre-surgery instructions. Make sure you do what you can to sleep and rest. And I know sometimes that's a very difficult thing because your mind is racing and you're probably worried and concerned, but do what you can to relax. Maybe just take some deep breaths. That's all that you need sometimes.
Yeah. That's so true. Thank you for that. And earlier you mentioned about selecting your team and select your surgeon and everyone. And right now, I think as a society, as a whole universe, there is a big problem. Sometimes people just have a different insurance, and it's so difficult. If someone wants to go to a certain provider and complains, well, it's not in this network, it's not in that network. And I think this is something that, we have all together, we have to work. Do you have any comments about this? I don't have a solution. And if someone in the audience has solution, please contact us at thedoctorconnect.org. Yes, yes.
Well, you know what? And I agree with you because yes, it's a very interesting time in our history in general, but particularly in healthcare. And I always encourage people to ask their family and friends, who would they go to? Who's a good provider? Who do they feel that they could trust? And somehow, if it's in your network, great. If it's not, sometimes you go out of network. But you need to take care of, and it's almost like you were still in charge. You can make these decisions. It may be more of a financial thing, but the thing is, I think overall, your peace of mind is the most important thing, and your health and wellness is your priority.
That's correct. And now, we prepare for surgery. We are going through the surgery, and now we got home. And now what? Do you have any tips how to speed up recovery, or anything we can do for better healing? I mean, healing is all. It's a physical, it's emotional, it's financial, it's all of it.
All of it.
Yes. Mm-hmm.
I feel the most important thing is to make sure you have a healing environment at home, meaning that you have, decreased your stress as much as you can. And I know for some people, they're thinking, how could that be possible? Because they're busy in a busy household. They have kids, they have family that they're probably tending to. Your environment is very key for your healing and your healing success. Make sure that it's calm. If you have a place where you could be, like your room where, you sleep, make that a very calming and restful place. Make sure that, it's okay. It's a reminder. It's okay to ask other people for help, because I think a lot of people think that they have to do it on their own. It's like they're used to being in control and running the household. And maybe this is a time where they just need to relinquish this and let other people serve them and take care of them.
That's true, especially all of this about controlling, and how a lot of people just try to do themselves. And a lot of times we just say, it's okay to let someone take care of you. Thank you very much. Thank you very much, Dr. Dolores. And for everything, how people can reach out to you. Can you tell us a little bit about what you do and how the audience can reach out to you?
Thank you, Dr. Schaefer. I appreciate that. You could reach out to me through my website, drdoloresfazzino.com. I actually help people. I have a concierge surgical coaching program that goes in a little deeper for people who want more personal one-on-one care. And I work with people individually before surgery, during, and after, so that they could have the best outcomes that they can have. And I integrate the body, mind, and soul, so they have more of a complete comprehensive healing on all levels, and possibly get to a core issue that maybe created the physical concern that they are experiencing. So thank you very much, Dr. Schaefer. I appreciate that.
Thank you very much, Dr. Dolores, for being with us. Thank you. One of our viewers just asked me a question. I can't believe I was diagnosed with cancer. I feel like someone would just explain why it takes so long from the diagnosis to start the treatment. I am so here, and I understand how much pressure, and this question probably have a lot of in other people's mind. It would depend on the type of the cancer, but I will share what's happening behind the scene. So learning to navigate the healthcare system post-pandemic is very stressful and challenging. It's more stressful than ever to see the doctor, wear mask, and it makes so difficult to understand your medical plan than ever before, especially terminology upon the cancer diagnosis. As a cancer doctor, I know the firsthand that the patients are often overwhelmed with the categories of information needed to make the informed decisions themselves or for the loved one. And I would like to simplify the information about cancer diagnosis and the treatment options and plan of care. And also, I will show you how decisions are made behind the scenes. All starts from pathologist. Pathologist is the type of specialty that read the diagnosis, looks on the microscope, and does a special stain to identify the appropriate diagnosis. Once the appropriate diagnosis is proven, then we always do a molecular marker, and that is a special signature on the cells, like I told you earlier, to identify what treatment would be appropriate for you. All information then discussed at the multidisciplinary team. What does it mean? The doctors, experts of different fields get together in one room to review diagnoses, review your scans, your pathology, biopsy, and then make a decision. Only after that the plan finalized and addressed cutting-edge treatment. We have several types of treatment that chemotherapy, immunotherapy, and targeted treatment, in addition to radiation and surgery and many other treatments that you probably heard. And I will give you 3 keys to help you while you are waiting for your plan to be made. Number 1, write down on the paper what are your new symptoms in advance, and prepare all tests and all doctors if you remember that you've seen in the past, and think what would you like to ask about clinical trials. And if you have never heard of clinical trials, it's a public website, clinicaltrials.gov. Thank you very much for being with us on the Dr. Connect show. Please submit your questions on thedoctorconnect.org and subscribe our YouTube channel, The Doctor Connect. Tell us what you like about the show and leave review or comment. Thank you very much for being on this journey with us, and we are looking forward to seeing you soon.